Why do men wake up with erections? Is it because of sexual dreams? Does it mean you are healthy? And what happens if you stop having them? Many men notice morning erections throughout their lives, but very few actually understand what they mean. Curious. Some men wake up with them almost every day, others notice them only occasionally. And some men suddenly realize something strange. They used to have morning erections, but now they don't. Surprised. So, this raises several important questions. Are morning erections normal? Do they mean your testosterone levels are good? Are they related to sexual desire? And if you stop having morning erections, does that mean something is wrong with your body? Interestingly, morning erections are actually one of the most important indicators of male sexual health. Thoughtful doctors often use them as a simple way to understand whether erectile problems are caused by physical issues or psychological factors. In fact, the presence or absence of morning erections can tell us a lot about blood flow, nerve function, hormonal balance, and even sleep quality. Today, we are going to explain the real science behind morning erections. We will talk about what they are, why they happen, what they tell us about your health, and when the absence of morning erections may indicate a medical problem. Before we continue, let me introduce myself. My name is Dr. César Noval. I am a plastic surgeon and the director of Clinica NEF. I specialize in penile enlargement surgery and gender surgery. Our clinics are currently located in Spain, Mexico, and Miami, and we treat patients from many different countries around the world. Our main educational YouTube channel is our Spanish channel, Clinica NF, where we have built a community of more than 100,000 subscribers. On that channel, we talk about male sexual health, penis anatomy, erections, sexual performance, and medical treatments. Because many people from different countries began asking for this information in English, we created this channel as well. Since my schedule does not allow me to record every single video again in English, we are using artificial intelligence to translate and recreate our educational content so it can reach a larger international audience. The goal of this channel is simple: to provide reliable medical information about male sexual health, erections, and treatments. Now let's return to the topic of morning erections. The medical name for a morning erection is nocturnal penile tumescence. This simply means erections that occur during sleep. Most men believe that morning erections are caused by sexual dreams, but that is actually not true. Morning erections are mainly linked to sleep cycles. During the night, our bodies go through different stages of sleep. One of these stages is called REM sleep, which stands for rapid eye movement sleep. This is the stage where dreaming usually occurs. During REM sleep, several interesting things happen in the body. Brain activity increases, heart rate changes, breathing patterns change, and the nervous system behaves differently than during normal waking hours. One of the most important changes during REM sleep involves the autonomic nervous system. This system controls automatic body functions such as heart rate, digestion, and blood flow. During REM sleep, the parasympathetic nervous system becomes more active. This system is responsible for relaxation and sexual arousal. When this system becomes dominant, blood vessels relax and blood flow increases in certain parts of the body. This includes the penis. As blood flows into the erectile tissue, the penis becomes erect. This process can happen multiple times during the night. In fact, most men experience 3 to 5 erections every night during sleep. Each erection may last between 20 and 40 minutes. By the time you wake up in the morning, you may simply be waking during one of these natural erection cycles. That is why it is called a morning erection, even though it actually began during sleep. Now, here is the fascinating part. These erections occur without sexual stimulation. They are not triggered by thoughts or fantasies. They are part of the body's natural physiological cycles. Researchers believe these erections serve several purposes. One possible function is maintaining the health of erectile tissue. The penis contains specialized vascular tissue that requires regular oxygenation. During erections, blood flow increases dramatically. This increased blood flow delivers oxygen to the erectile tissue. Without regular oxygenation, the tissue could gradually lose elasticity. Nighttime erections may help maintain the health and flexibility of these tissues. Another possible function is related to neurological testing. During sleep, the brain may be essentially checking whether the nerves and blood vessels involved in erections are functioning correctly. Think of it as a nightly system test. Now, this leads to an extremely important medical point. Morning erections can help doctors distinguish between psychological erectile dysfunction and physical erectile dysfunction. If a man has difficulty getting erections during sexual activity but still experiences normal morning erections, this usually suggests that the physical structures involved in erections are functioning normally. The blood vessels work, the nerves work, the erectile tissue works. In these cases, the problem may be related to stress, anxiety, relationship dynamics, or performance pressure. However, if a man stops having morning erections entirely, it can sometimes indicate a physical issue. For example, reduced blood flow, hormonal problems, neurological conditions, cardiovascular disease. This is why doctors often ask a very simple question when evaluating erectile dysfunction. Do you still have morning erections? It is a quick but valuable clinical clue. Another factor that influences morning erections is testosterone. Testosterone levels follow a daily rhythm. They are usually highest in the early morning hours. Higher testosterone levels can contribute to stronger nocturnal erections. However, testosterone is not the only factor involved. Sleep quality also plays a major role. Poor sleep can significantly reduce nocturnal erections. Sleep disorders, such as sleep apnea, can disrupt REM sleep cycles. When REM sleep is disrupted, nighttime erections may become less frequent. This is why chronic sleep deprivation can affect sexual health. Men who sleep poorly often experience reduced libido, lower testosterone levels, and weaker erections. Stress is another important factor. High levels of stress hormones, such as cortisol, can interfere with the nervous system signals required for erections. Stress can also disrupt sleep quality. This creates a double effect. Poor sleep reduces REM cycles, and increased stress interferes with erection signals. Lifestyle habits also influence erectile health. Smoking damages blood vessels. Excessive alcohol affects nerve function. Obesity reduces testosterone levels and impairs circulation. Physical inactivity weakens cardiovascular health. All of these factors can affect both daytime erections and nighttime erections. Now let's talk about age. Younger men typically experience stronger and more frequent nocturnal erections. As men age, these erections may become less frequent. However, they should not disappear completely in healthy individuals. Even older men often experience nocturnal erections if their vascular and neurological systems are functioning properly. If someone notices a sudden disappearance of morning erections, it may be worth evaluating possible causes. For example, changes in medication, sleep disorders, hormonal changes, cardiovascular issues, psychological stress. Medical evaluation can help determine whether further testing is necessary. In some cases, doctors use specialized devices to monitor nocturnal erections during sleep. These tests measure the number, duration, and rigidity of nighttime erections. They can help determine whether erectile dysfunction is primarily physical or psychological. However, in many cases, simple clinical history provides enough information. Understanding morning erections helps men better understand their bodies. They are not random, they are not embarrassing, they are a natural part of male physiology, and they provide valuable information about sexual health. So the next time you wake up with a morning erection, remember that it is actually a sign that your body systems are working correctly. Your nervous system,
Your blood circulation, your hormonal balance, your sleep cycles, all of these systems work together to produce that simple physiological response. And when these systems are healthy, erections usually follow naturally. If you are interested in learning more about erections, male sexual health, penis anatomy, and treatments explained by a doctor, make sure to subscribe to this channel, because here we will continue exploring these topics with clear, evidence based medical information designed to help you better understand your body and improve your health.